which is a sex worker-led organization working here in Zimbabwe. So today we are very happy for the launch of the Lenacapavir, which is something it's again as sex workers. Tangatine pill burden, sema sex workers. Client ikatongowana ndine mapiritsi chete. They always think that I'm on art. But now with this Lenacapavir, it means we have closed the gap of violence, which is GBV. So here in Zimbabwe, we are happy with that. And also, it is very easy, I say Zimbabwe, kuti tisange takwanisa close the gaps, kubata ma targets edu, ma 95 targets, because handisina pill burden, handisina violence, handisharoone ma clients. So hakuna chinondinetsa kuuya kuchipatara. And also visiting only 2 times per year for clinic ndichibaiwa Lenacapavir. It's something that is a thumbs up for us as sex workers, because nguva yangu yakawanda yakuperera kubasa. And also this zvinondipa mukana wekuti ndingowana chinhu chimwe chete chandishataura kumbeki rangu, ndichangotakura condom chete, handichatakuri condom plus gaba remapiritsi ndichienda kubasa. So we are very happy as sex workers here in Zimbabwe with this Lenacapavir. Thank you so much, Zimbabwe, for accepting Lenacapavir here in Zimbabwe. Thank you.
You know, we are so excited about this phase 1 rollout of Lenacapavir, a twice yearly injection. And for us as young people, you know, it means several choices. You know, you can have an injection, you can have the PrEP pills, you can have the, you know, Tapirafine ring. And for us as young people, it's not only about the injection and the options, but it's also about the peer providers, the peer counselors, creating a space, you know, to educate young people more about these HIV prevention options and to end AIDS by 2030. To also, you know, provide counseling as well as refer for other social and healthcare needs.
With this program, Lenacapavir injection, this is to connect my young mental mothers, my young mothers, those who are negative. So to know information about HIV. Then after that, they will be referred for HIV prevention methods like this PrEP. So after that, Munaka initiate our own PrEP. We are not stopping there. Tirikuramba teach support my young mothers by giving them social psycho support, teach mental health screening, teach STI screenings and intimate partner violence. Tirikutara kuti munhu ngazvidzivirire kubva ku HIV.
For the communities that we serve, it means that their choices for HIV prevention have increased. They don't have to just only think about taking a tablet every day. They now have a choice which you can get an injection that lasts for 6 months. So you can be protected for a longer period without worrying about whether you can go to a clinic, whether someone is going to find tablets with you and, you know, start to ask you questions. And it is effective protection, above 96%. So it means they can be confident that they're protected from HIV.
Today we are here at the Lenacapavir launch, and this is a game changer for HIV prevention. So we are going to do an injectable medication, which is given once in 6 months. Then what it means, the HIV prevention program is to say it places the patient clients in terms of injection, and also we are saying to our clients, this will improve the quality of life to have less frequent.
So as Zimbabwe National Family Planning Council, again, we are working together with our National AIDS Council to ensure that when we then go into the communities, we then disseminate correct and consistent information about the Lenacapavir, and also to ensure that as we conduct our community engagements, we also talk about the prevention method, and this gives comprehensive information in terms of the preventive methods which we have against HIV and AIDS in the country.
It's a really exciting
Once again, let's put our hands together for Mr. Chikoko, Trouble, the UN resident and humanitarian coordinator in Zimbabwe, represented today. Thank you. Sorry, sir. Initially, I did not acknowledge you because you are very important. Let's put our hands together for him once more. Thank you. As we continue, ladies and gentlemen, with our day's program, we are going to kindly ask another solidarity remark from Philip Neville, who is also representing the U.S. ambassador to the Republic of Zimbabwe. Over to you, sir, Philip Neville.
So, on behalf of the National AIDS Council Board, as the Vice Chairperson, we are very happy and delighted, and we are very honored to be part of the 9 countries that is launching this injection, which I can shortly refer to as the LEN. It's an important drug, it's an important step towards the prevention of the transmission of HIV and AIDS. It is a very good step, a positive step towards elimination of the HIV. As you know, Zimbabwe as a country, we have achieved the targets. We have since achieved the targets that we have. So this step further strengthens us because we have achieved the reduction of the HIV. We have achieved the 95 goal. So with this drug, we're further going to be a step further towards the total reduction or annihilation of the HIV virus and AIDS.